Hi.
Hi, can you hear me
Hello.
okay?
Yes, absolutely fine. Thank you.
Brilliant.
You?
Yeah, I can see you great. How are you doing? You all right?
Yes, I'm well. Thank you. Yeah,
Thank
thank
you
you.
so much for agreeing to sit down for me with me. I really appreciate it.
Pleasure. Yeah.
Um, okay, well, I'll jump straight into it because I know that you don't have a lot of time. Would you mind for our readers introducing yourself briefly and just kind of explaining who you are and so on?
Sure. Yeah. So, my name is Pallavi Devupalli. I'm a GP. I originally did my graduation in India, so I'm a first generation immigrant to this country. I've been in the UK for 20 plus years now, long time. Most of the time in Norfolk. I practice in West Norfolk in a GP practice. I've been a member of the Green Party for a few years, and I'm currently the Green Party health spokesperson.
Wow, amazing. Okay. Um, so could you, for our, just for anyone who maybe doesn't have a lot of, I mean, obviously everyone has experience of the NHS, but could you, for our readers, paint a little bit of a picture of what you see as the crisis in the NHS as it stands, and compare that to what a healthy NHS might look like?
Yeah, sure. So, first of all, I think health should be a lot more than the NHS. So I just want to put that out there for people to think about. Within the Green Party, we're very keen to look at the wider determinants of health. And we know for a fact that things like your finances, your access to green spaces, your ability to take exercise in a safe way, and live in security has a huge impact on health, both physical and mental. Um, Talking about the NHS specifically, there is absolutely no doubt that the NHS is in crisis right now. It's at breaking point if it hasn't broken already. It's a huge organization. So to kind of call it the NHS in a way is a bit of a misnomer because there are bits of it that are failing. There are bits that have failed already and bits that are still working, although they're struggling. So just taking a broad view, we have vacancies within the NHS of more than 100,000 healthcare workers. You know, we're short of just about everything. We're short of GPs, we're short of psychiatrists, we're short of nurses, you know, you name it and we're short of them. So we have a workforce crisis. We have a retention crisis. So people who've reached the peak of their careers, who've got loads of experience behind them, are finding that they don't want to carry on working. You know, they're burnt out, they're exhausted, they're demoralized, they feel they're not being heard. And increasingly, they're asking themselves, why should I carry on? And they're choosing to leave. They're walking with their, you know, they're talking with their feet. They are leaving. Young people joining the service are asking themselves, why are we going to put ourselves through this? And they're emigrating. So on both ends of the spectrum, it's not looking good at all. We have a complete failure of leadership. There's been a failure of workforce planning, which has gone in, you know, for the past decade at least, which has led partly to the crisis we're in today. So it's a complex issue, but I would start with the workforce because that's really the linchpin of the entire NHS. The NHS is its workforce and the infrastructure that houses them, and neither of which are actually adequate or functioning at the moment.
See, thank you so much. What would you say to uh, government ministers who suggest that the vacancies and long waiting lists and other issues in the NHS are a result of the pandemic and the state of the global economy as it stands right now? What would you say to that comment?
It's simply not true. You know, we were struggling in the NHS before the pandemic came along. The pandemic was like the final straw on the camel's back. Waiting times had been going up steadily for years before the pandemic. You know, we have been delivering an unsatisfactory level of service for most of our population for a few years now. With the pandemic putting a halt to all elective activity, the situation has just spiraled and yeah, it's spiraled out of control, I would say now. But this predates the pandemic, and this is a lack of workforce planning that goes back several governments, not just the current one, but no government has actually sat down with the experts who work in the NHS to say, how many doctors do we need? How many nurses do we need? How do we get them? In fact, what they've done is successively, they've made it harder and harder and less attractive for people to enter medical nursing professions. Nurses' bursaries were removed. Nurses have to take loans now to become nurses. I think it's a scandal.
See, that makes sense. So in addition to what you've already raised some really interesting points. In addition to that, is there anything that if you were sat down with the government that you would want to instruct them on? Is there anything that like specifically that you would do? Obviously, I know it's a big topic, but if you could give some idea as to the fixes that the government could implement.
Sure, yeah. I mean, my first ask would be that they actually take the demands for pay seriously. Nurses, the RCN has never called a strike in its entire history. The fact that they've been driven to that point this year is indicative of just how appalling pay is and how appalling morale is within the nursing profession. And the same goes for junior doctors. The junior doctors' discontent has been rumbling on for a few years now, going back to when Jeremy Hunt was a health minister, or Secretary of State for Health, I should say. And instead of resolving the problem, they chose to turn a blind eye to it, resulting in an exodus of our young doctors abroad. So the first thing the government needs to do is tackle pay. They need to make sure that NHS pay is in line with inflation so that it's at least paying the bills for those who are working within it. The workers within the NHS the NHS is surviving on the goodwill of the people who are working within it at the moment. And goodwill doesn't pay bills, I'm afraid. We have to pay our bills same as everybody else. And if you are then relying on a food bank to feed your children after putting in 40+ hours at work, it's simply not right. That's exploitation. And that needs to stop. So the first thing they need to do is sit at the table and agree a sensible pay package now and going forward into the future. The second thing they need to do is look at the requirements of the health service and make sure that there is a proper workforce strategy in place so that we are training enough of our own healthcare workers for the next 2 decades or 3 decades, because it takes 10 years to produce a specialist doctor. It takes 4 years to produce a nurse who's then able to work on the wards. So we need a slightly more long-term thinking behind this. Ideally, they would pass it to someone who wouldn't then change at the next election. So it would be an independent review workforce that then look at the needs of the health of the population and work on that accordingly, which would then sort of carry on through elections and through successive changes of government. Again, it comes back to things like dignity at work as well. So we have mixed messages at the moment about the amount of support that workers get within the healthcare service when something happens and they're working in an inadequately staffed ward or surgery or whatever. We need clear messaging from the government to the public, explaining the strain that the NHS is under and encouraging people to actually look after their own health and also to be realistic about what they expect from the health service. I don't think that's happening. I don't think there's been any honesty from politicians who are in power putting that message out to the public. That would also help to actually help the public understand what is actually going on, just how bad the situation is. Some honesty and openness would be very welcome.